Across the globe, millions of individuals are dealing with some form of cardiovascular disease. When we say cardiovascular disease, we mean diseases that impact the heart and blood vessels. Only in the United States, we have about 85 million people that suffer from some form of cardiovascular disease. This is the #1 cause of death for both men and women in the United States. And in this video, I would like to start talking about how we end up with the formation of plaque in the wall of our, for example, arteries, which the condition is called atherosclerosis, and it's due to depositing cholesterol in the wall of arteries. And please keep in mind, when plaque forms in the wall of arteries, several things would happen. One would be that the arteries, their wall loses its elasticity. And please recall that in many of our arteries, we need the elasticity to help flow of blood. And also when plaque forms, obviously it narrows down the lumen of the arteries and eventually blocks the flow of the blood. So that places the health of that individual at risk. And we know that atherosclerosis has been linked to diets that are high in cholesterol, saturated fat, and trans fat. These diets in general have low amount of healthy fat, unsaturated fat, and also low amount of fibers. So in this video, I'm going to explain how much cholesterol we need and how we can reduce the risk of atherosclerosis. But to start this story, we have to go back to our largest gland, which is liver. Liver cells are extremely creative. They produce plenty of different products, and then they release their products into bloodstream. From liver cells, obviously their product will be released through the hepatic veins into inferior vena cava, which we know inferior vena cava takes this blood and the products within the blood into the right atrium. And then from right atrium, we know that blood goes into the right ventricle, and then right ventricle pumps blood into the lungs to become oxygenated. After blood is oxygenated, it comes back to the left side of the heart, and eventually the left ventricle is going to pump this blood, which contains lots of products that our cells need to our systems. So clearly what liver cells produce must travel in blood. However, when liver cells produce lipid, we have to notice something very important about lipids, that the large lipid molecules such as triglyceride, long chains of fatty acid, these molecules are hydrophobic, so they have difficulty to be in a watery environment such as in blood. That's why liver cells have to do some packaging. What I mean is they place, for example, these triglyceride molecules that they build within an envelope that is made of proteins and different type of lipids such as phospholipid, cholesterol. So liver cells produce some particles that we refer to them as very low density lipoproteins. The reason that we say lipoproteins because, as I mentioned, these particles contain proteins and lipids. And in short, we name these very low density lipoproteins that liver cells produce VLDLs. Liver cells release these particles into bloodstream, and we know that these VLDLs travel in blood. And when we get to our, for example, systemic capillaries, that would be the best place that those triglyceride molecules can be removed from VLDLs and go into our tissues. So now imagine when these large particles lose their triglyceride, obviously they shrink, they get smaller and denser, and what we have here left of VLDLs in blood, about 2/3 of them return to the liver. If liver cells can reuse them, they will. If there is no use for these components that come back to the liver, then liver cells prepare them to be excreted out of the body. Now the question is, what happens to 1/3 of these particles that stay in blood? The 1/3 transforms into some smaller and denser particles that we name them low density lipoproteins. or in short, LDL. LDL is the primary cholesterol delivery system for our cells. It has a high proportion of cholesterol, much higher than VLDLs that liver cells produce. So in short, LDL forms inside the bloodstream, contains a large amount of cholesterol. And now the question is how we can get these LDLs out of bloodstream into the cells. The answer is for LDLs to get into the cells, we need some proteins in the membrane of cells that we name them LDL receptor. It simply means that LDL has to bind to the LDL receptor, and then the cell can actually take it in and use its cholesterol for whatever reason that cell needs cholesterol for. Please keep in mind, cells use cholesterol in formation of their membrane. For example, if there is a need to repair the membrane, if cell is growing and eventually going through mitosis to divide into two identical cells, and also some of our cells, like cells that we have in testes, ovaries, can use cholesterol to produce hormones such as sex hormones. So cells have some use for cholesterol. However, when we say removal of LDL from blood is possible depending on the presence of the LDL receptor, clearly if we do not have enough LDL receptor on the membrane of our cells, we cannot take all the LDL out of bloodstream. It means that many of them stay inside the bloodstream. So the number of LDL receptors affect how much cholesterol can be removed from blood. And this applies to some individuals that genetically they are designed to not produce enough numbers of LDL receptors. Please keep in mind, some of these individuals could be healthy, they have an active lifestyle, they're not obese. The only problem that they have is that their cells are not producing enough LDL receptors, so they end up with high blood cholesterol level. In some other cases, we consume too much cholesterol. Please keep in mind, our cells are not greedy. They take as much cholesterol as they need to, and the rest will be left in blood. These are two examples how we end up with high blood LDL level. Now quickly, I go through a cross-section of an artery to emphasize what happens when we are left with too much LDL in our blood. When I look at the wall of this artery, I can see three layers. In tunica interna, the inner layer, one of the main components would be the simple squamous epithelial cells that we refer to it as endothelium. The most of the bulk of the wall is made of smooth muscle cells, and then the tunica externa, the outer layer, is a protective connective tissue. Now imagine we have too much LDL flowing in blood, either because we do not build enough LDL receptors in our cells, or we consume too much cholesterol. In that case, LDL can actually start entering the wall of our blood vessels. Basically, it attaches to the wall of this artery and start getting in. Or if there is a damage in the wall of the artery, that would be a great opportunity for LDL to enter the wall of this artery. And then a process, a chemical reaction named oxidation is going to happen. When we say oxidation, we refer to those chemical reactions that the substances are losing their electrons because of reacting with the reactive oxygen molecules. So the result of oxidation of LDL would be something called oxidized LDL cholesterol. This is the harmful cholesterol. So to our body, it looked like that basically the wall of this artery has been attacked. This oxidized LDL cholesterol initiate the process of inflammation. Please keep in mind, inflammation is an immune response. Basically, the intention of immune system is good. The immune system tries to start inflammation in this area, remove those harmful substances, and prepare the area for repair. So we see next step, our soldiers, the leukocyte, white blood cells, migrate to the area. And we know that monocytes, after migrating into the tissue, can differentiate, change into macrophages. And one of the expertise of macrophages would be phagocytosis, eating solid particles. So we see in the next step, the macrophages start phagocytosis of this harmful oxidized LDL cholesterol. And these cells, because they eat lots of this oxidized LDL cholesterol, They enlarge. At this point, when we use microscope and look at these very large macrophages full of oxidized LDL cholesterol, they have a foamy appearance. That's why we name them foam cells. And eventually, we can say that this cell tries to remove and eat so much of these harmful substances that it bursts. And that would be the formation of plaque in the wall of this artery. And this process, basically the LDL goes through oxidation, becomes oxidized LDL cholesterol, be phagocytized by macrophages, foam cells form, and then they burst, keep happening. Basically the inflammation becomes chronic, continuous, and that adds to the size of this plaque. And as you can see, when the size of the plaque increases, first, we know that the wall of this artery is not healthy anymore. It does not have the strength and also the elasticity. And also we see that the lumen of this artery keep getting narrower and narrower, and at some point it is completely blocked. Now that we have learned the steps that leads to the formation of atherosclerosis plaque, it is important to note that depending on the plaque forms and block which artery, we end up with different health issues. For example, if the plaque forms and blocks one of the branches of the coronary arteries, recall coronary arteries are those arteries that supply the wall of the heart with oxygenated blood. If one of these branches is blocked by formation of plaque or blood clot, clearly the part of the wall of the heart that is supposed to receive oxygenated blood through that branch will be at risk of dying. And when the cells in the wall of the heart die, that would be heart attack. Depending on in the wall of which chamber, we end up with death of the cells. We have different prognosis. We know that between the 4 chambers of the heart, the one that has the most challenging job because it has to pump blood almost everywhere is the left ventricle, which that simply means if the heart attack happens in the wall of left ventricle, the prognosis is worse than if heart attack happens in the wall of atria or even in the wall of right ventricle. If any of the blood vessels that supply the brain is blocked by formation of plaque, obviously the consequence would be stroke. If an artery that we have in our upper or lower limb is blocked, then we end up with peripheral artery disease that could cause many different health issues, which in separate videos I talk about each one of these individually. What is important to note in this video, if we have a diet high in fat, especially unhealthy fat, we end up with more production of very low density lipoproteins by liver cells, which the result would be elevating the LDL level in blood. Recall that when the triglyceride molecules are removed, the particles that are left, about 1/3 of them, turn into LDL. In adults, when we do a blood test, the desirable LDL cholesterol level is under 130 milligram per deciliter. In other videos, I talk about the HDL and the ratio between LDL and HDL. But for now, let's learn a few techniques to reduce the risk of formation of atherosclerosis plaque in our arteries. One clearly is regular physical activity, and by physical activity specifically we're focusing on those aerobic or near aerobic physical activities. In the video Maximum Heart Rate, I provide you the information about the exercise recommendation for adults per day. This is something that is very important, that we have to physically stay active. The next approach obviously would be having a healthy diet. When we say healthy diet, we mean that when it comes to fat, we need to limit how much we consume unhealthy fat. That would be the saturated fat. These are usually the type of fat that stays solid in room temperature. Also taking minimal amount of trans fat. When it comes to cholesterol, the new dietary guidelines emphasize to take cholesterol as minimum as possible. We need to really limit how much cholesterol we consume. For example, one medium-sized egg has about 200 milligrams of cholesterol. So if you have the habit of having egg every day for breakfast, maybe you should rethink about this habit. and do not include something that is so high in cholesterol in everyday diet. The next thing would be when you choose, for example, meat, how about you go with lean meat, or sometimes you go with seafood, or if there is fat attached to the meat, you can easily trim it. Another practical approach is if you reduce your portion size, in general, you end up with consuming also less fat. So there are different ways that we can move toward a healthy diet, and I'm sure we know that in a healthy diet we should also include soluble and insoluble fibers. Soluble fibers have been shown that they can reduce the risk of some of the cardiovascular diseases, including formation of atherosclerosis, plaque. And insoluble fibers are the ones that add to the volume of solid waste, so defecation happens on regular basis. If your primary physician prescribed drugs for you to lower your cholesterol level, that is absolutely necessary to take. Taking the medication is very important. Recall that we said, genetically speaking, some individuals do not produce enough number of LDL receptors. And also non-smokers have a lower risk of formation of plaque in their arteries. So these are a few practical approaches that help to reduce our blood cholesterol level and reduce the risk of formation of plaque in our arteries. I hope you find this helpful.